I think the noticeable change in him came after he was retiring from the police force that he was with for 35 years. And at first I thought it was a bit of a regret or a bit of a sadness that came with leaving a job that he loved. But there were other symptoms that were coming to light, as in when he went to the store to pick up some things, it would be always the same things every time, just like you see on the commercial with the old man who opens the fridge and there's like a whole shelf of milk. That was one, silly little things like that. He had a bit of problem with his left eye at the time, a blockage. And we went to the optometrist sent him to a neurologist, and they thought he might have had some mini strokes, but there was never anything conclusive. So that kind of got the ball rolling to look and to see, okay, was he suffering some kind of a depression from retiring, or was there actually something else going on neurologically? And so we would attend at the doctor's and they would do the memory test. And there was some indication, generally he was pretty good, but there were a few areas where he would just immediately forget what the answer would be. So we were referred from one doctor to another, eventually ending up at Parkwood Hospital with Dr. Jenny Wells, and she's the specialist in geriatrics there. And she got us on the right path to helping him with this, because in Roger's case, his Alzheimer's is familial. His mother and father had it, and his two older brothers also had it. And one recently passed with cancer and Alzheimer's, and the other one is now currently going into a home for patients with Alzheimer's. So we're very aware that this could happen to him as well, and we've been following it very closely. I think some people are afraid that they'll have the stigma of losing something in their brain, or people not understanding, or perhaps not being bothered with them or laughing at them, or, you know, that sounds kind of rude, but I think it has happened in the past when you don't really understand the disease. And I think that's changed a lot now with the awareness campaigns that we've had in the last few years. I would say if you have symptoms and you're not understanding what's going on, speak to somebody. You usually have to start with your doctor, but don't be afraid to ask to go past that, because many doctors are very busy too, and they don't always have the expertise in every area. So ask for a specialist, or read about it, research it yourself a little bit, and find out if you really have a problem that should be followed up on.
If you or someone you know could benefit from the services at the Alzheimer Society, or if you'd like to get involved and become a volunteer, please visit your local Alzheimer Society.